This is meant for all Islanders. It's not meant simply for people who use this hospital as their community hospital. 22 different services that will be available. The surroundings are going to be much more pleasant for patients. It's going to be much more comfortable. I think with the added rooms we'll have to work out of, probably patients will be kept waiting a little less in terms of getting the service they're here for. And probably we'll be able to deal with more patients in a given time frame as well, so that it should shorten the waiting lists as well.
And so it is extremely gratifying to be part of this official opening today, and to know that this new centre will bring the quality of care at the QEH up to another level and put it at the forefront of health services delivery anywhere.
Well, healthcare is our #1 priority, and making sure that we have accessible health services for Islanders is extremely important. This new facility, ambulatory care, is going to allow a more efficient delivery of health care. It's going to be better for the patients, be much better for the staff, and will help us deliver better services to Islanders. Really, that's what it's about. Before, it was very cramped in a lot of areas of the QEH, and this will allow certain areas to be able to deliver better services.
For the 65,000 Islanders who use the QEH as their community hospital, and the 145,000 Islanders it serves as a primary referral hospital today, marks a major step forward in health service delivery. It is a shining example of our government's investment in the future of our healthcare system and its viability and sustainability.
Well, our primary focus right now with the opening of the ambulatory care and the investments that we've made will increase overall patient experience and patient outcomes. Currently, we have a range of services provided to Islanders that are distributed across the hospital. And with the opening of the Ambulatory Care Centre, it'll be a more collaborative model of service delivery in respect to a range of services that are currently provided. So it'll provide an opportunity for Islanders to be given a more efficient level of treatment in a more timely fashion, which will result in a more positive experience.
And they range all the way from specimen collection, and that means patients who are booked for example, an operation, come into the hospital to have blood tests done, to have a few other tests done as sort of a pre-admission type of thing. They'll come here. Patients who are scheduled to have various scopes, looking in the stomach, looking in the bowel, looking in the bladder, they'll come to the Ambulatory Care Centre for those procedures. Orthopedic clinics will be run out of here, as will plastic surgery clinics, so that if you have a lump or bump that needs to be removed, this is where you'll come for those services.
On behalf of the family, I should indicate that our late sister Eileen, as many of you know, was a nurse and an educator, and was very involved with a wide variety of volunteer and philanthropic activities, mainly in the area of cancer. But as on a previous donation to the nursing school at the university, she did not want any large recognition or publicity, and that was her nature. Instead, she indicated to the foundation that the money would go to the use of their choice, in this case a combination of naming and an investment fund to provide future equipment, and that whatever recognition would go to our late parents.
People are the most important element in the delivery of healthcare in our system. And any of us who have had a reason to use this hospital know that we do not find a finer, more caring staff anywhere. I know all of you will take this centre as a great source of pride into the future. Thank you very much, and thank you for everyone for attending today.